Hi, I'm Adele Gautier, Research and Advocacy Manager at Breast Cancer Foundation NZ. We're a charity working to improve treatment and support for Kiwis with breast cancer.
Hello, my name's Blaik Wilson. I'm Chief Operating Officer for Cemplicity. Cemplicity is an Auckland-based patient-reported measures technology company. There are a number of key things we want to cover in the webinar today. Firstly, New Zealand's track record in treating advanced breast cancer is not great. One of the reasons for that is a lack of symptoms management. During the treatment for advanced breast cancer, people experience a number of symptoms, multiple symptoms and multiple side effects. And right now there's no real pathway except for clinic visits themselves to share those symptoms. And that can lead to symptoms getting worse, reduced quality of life, people withdrawing or disqualifying for treatment, and ultimately shortening of life. But recent evidence suggests there's a better way to do this, and what they're going to look at today is how patients have a feedback channel while they're at home to share their symptoms, how the clinical team will get real-time alerts for adverse changes in those symptoms and get some clinical decision support around that entire process. And we think this is even more important in the age of COVID and the increasing use of telehealth. This is real. We are piloting a program starting this month at Waikato DHB, and today we're going to show you exactly how that's going to work and how it will improve symptoms management. I'll pass it on to Adele now.
So every year, 350 New Zealanders will be diagnosed with advanced breast cancer. That's a terminal disease. There's no cure, but it is treatable, and what we aim to do is give women longer with their families with a decent quality of life. But is that happening? In 2018, Breast Cancer Foundation published a study, I'm Still Here, where we looked at patterns of diagnosis and survival of ABC in New Zealand, how patients feel about their quality of life and the treatment they're getting, and how that compares with the countries we like to think that we're comparable with. We had input from doctors, nurses, patients, and we did the first full analysis of treatment and survival data in the National Breast Cancer Register. And what happened? We found we're doing really badly. New Zealanders with ABC die faster than people in comparable countries, often much faster. They have fewer treatments, and because they feel abandoned by the system and that their care is no longer a priority, they feel isolated and unsupported at the very time when they need the most help. And a part of that is their symptom burden. Treatment for cancer generally and for ABC is very toxic, so that causes side effects. In addition to that, progressive advanced cancer has a number of disease symptoms as well, pain and shortness of breath and other symptoms that are very severe for patients. Those symptoms are not well treated in New Zealand. In our study, only a third of patients said they have good control of the symptoms. That's not just about a feel-good factor on a given day. That's the rest of your life, every day, with poor symptom management that can affect your ability to have treatment, your ability to stay on treatment, and sends you to the hospital more often with unscheduled emergency visits, acute clinic visits, causing problems for the health system as well. Yet at the same time, we saw from overseas studies that managing symptoms electronically in advanced cancer can improve quality of life and extend survival and reduce that unscheduled care. So why is symptom management so bad when we do have passionate caring clinical teams who want to help their patients? It's the way the system works, and I think these barriers will be familiar to most of you. Patients who go to the clinic, they have limited time in their appointment, and they only get that appointment every 3 months if they're not on active chemo. They may forget to discuss the problems that have been bugging them over the last few months. And then when they get back home, even though doctors and nurses will give them phone numbers, they can feel really reluctant to contact them. And when they do feel desperate enough to do so, they just can't get through because everyone's so busy.
So let's have a look at the solution that Breast Cancer New Zealand have put in place partnering with Cemplicity. There's three main elements to this CDS equation. First is the patient's clinical record. Second, obviously, the patient's self-reporting of their symptoms, and then a robust set of clinical guidelines. And through these three factors coming together, we're able to provide timely clinical decision support to the clinical team. Let me show you how it works. As soon as someone is diagnosed with advanced breast cancer, they are included in a patient data extract to Cemplicity. And they included that ongoingly from that point with various clinical data about that patient, including their medications, their comorbidities, and so on. Cemplicity opens up a channel with that patient with questionnaires about their symptoms. And later on, I'll show you exactly what that patient view of that channel looks like. As the patient responds and about their symptoms, two things happen within Cemplicity, pretty much simultaneously. One, we look at those symptoms and we compare them against thresholds. And if the symptoms exceed a threshold, for instance, the patient reports severe pain, or they report that their appetite levels are going down, a real-time alert is sent to the advanced breast cancer nurse specialist. At the same time, Cemplicity is taking the patient's symptoms along with their clinical data and feeding it into a clinical decision support engine called Cambio for real-time clinical decision support, which we can then share back with the nurse so they can understand more about how to treat the symptoms for that patient. They then decide on a course of action. They phone up or contact the patient, make some decisions, and record their clinical notes back in the DHP system. Adele, can you just explain briefly how the guidelines for the clinical decision support process were established?
Yes, sure. We're really concerned that a system like this needs to be acceptable right through New Zealand and needs to reflect best practice care both in New Zealand and internationally. So we established a clinical working group including oncologists, palliative care specialists and nurses and patients from around the country, and we have formulated the guidelines for supporting several core symptoms, the most common and the symptoms that are most debilitating for patients. And we also set, or the team, the clinical working group also set thresholds for when that symptom should change, should trigger an alert. And that would be a change in severity or the development of a new symptom or a change in frequency, for example.
I'm just going to show you now what a patient would see in terms of how they're reporting their symptoms during treatment. They will see a list up front on a landing page of various different symptoms that we know, as Adele said, are debilitating during treatment, or can be. They would choose the ones that they're experiencing today or over the last 7 days. And once they choose those, then we ask more detail about those symptoms to the patient. And so, for instance, this patient has selected pain, and then we're going to ask them very clearly about how often that pain is occurring, the severity of that pain, and how much that pain might be interfering in their daily life.
And I guess we should say, Blaik, that these are validated questions used from studies overseas. So we know that these questions work and produce results that we can look at and compare over time. And
of course, the way the survey is presented will work just as well on their desktop at home or on their smartphone. As soon as that patient submits those responses, what's happening is likely what I explained on the flowchart earlier. Cemplicity is looking at this and going, gosh, this person's in severe pain. I need to raise an alert. And they will send an email to the nurse specialist, such as this. It'll say so-and-so. It will keep it anonymous because it's in an email form, but say, we've got a trigger point here for pain severity, need to look deeper. And they'll very quickly click on the link here and they'll be taken to Cemplicity's reporting portal and straight into clinical decision support for this type of symptom for the patient. The nurse is going to first look at some of these contributing factors and causes around the symptom and then move into a mode of assessing the severity of the symptom, and they get some guidance here from the CDS.
That's right, because the patient has assessed the symptom themselves, but of course you want the nurse to be setting her own triaging level for that.
Further on, once they've assessed the grade of severity, they will then go into further details around what actions to take. And beyond that, they'll also look at the comorbidities and the medications and so forth for any mitigating factors that the nurse might need to take into account.
Yeah, and the system has produced only the comorbidity and medication information that's relevant to that patient, so you don't have to look at everything.
Behind this, we've got details of this individual's entire symptom journey that both the nurse and the oncologist can use in treating that patient. You can see here you've got a graph of their symptom journey, but down below we've got their individual responses colour-coded by the sentiment behind those responses. So here we can see with this patient that they got an alert for pain severity, but clearly all the three pain metrics they're experiencing some difficulties with, whereas other pain or other symptom metrics such as nausea, vomiting, they're doing quite well. Beyond an individual treatment journey, we really envisage that as this project evolves over time, of course, we're going to get lots of data around a typical patient's symptom journey through advanced breast cancer. And we can do some really useful reporting around that. I'll just give you a taste of it here very quickly. So here I can see the aggregate journey of all patients around pain. And I could very quickly add nausea symptoms as well to that journey and see those, and see that actually by week 2 nausea has not been so much of a problem when compared to pain, which seems to be getting higher. But then I can drill down further. I can look at different medications, different treatment pathways to see how it impacts that journey. I can look at demographics, so if I wanted to see New Zealand Māori performance against these metrics compared to the normal cohort, I can do that as well. And this, of course, is just the beginning of how this data can be used. I'm going to hand it back now to Adele, who's going to really talk you through what some of the expected outcomes of this project will be.
So as we get underway with this at Waikato, and we hope other sites in New Zealand too, we expect over the next few months to find that patients are willing and able to self-report their symptoms electronically. And that's what's been shown overseas in studies, that even patients who aren't used to computers and the internet can do this very easily and find it helpful. For the clinical team, they'll have access to real-time information about patient symptoms, and that will not only help that symptom management between appointments, but will also feed into the appointment with the oncologist and facilitate that and make that a more productive appointment. The most important thing about this, I think, is the equity that it brings to ABC care in New Zealand. Wherever these patients are, no matter how far from the hospital, no matter how hard it is for them to reach the hospital, they will have access to excellent symptom management by using best-in-class guidelines that will help reduce the variation in care around New Zealand, which is always a real issue. For the patients themselves, we'd expect better quality of life. They'll be able to stay on treatment longer, and hopefully that will help them live longer after diagnosis. For the DHB, there's a huge and obvious benefit in reducing unscheduled care visits in the macro scale, and in the micro, just better use of the clinic time when the patients are coming in and facilitating resource use better of staff and rooms and so on.
It's a really exciting project, and we welcome any questions that you have or you'd like to find out more. Thank you.